This teaching video is intended to help get you ready for your upcoming in-office procedure. We do a wide variety of procedures. It can be something that's really simple that just takes a few minutes or something that takes several hours. In general, when we are doing things in the office, it is just with numbing medicine that is called a local anesthetic. Now, you can also take something orally to help relax you, and we use Valium or diazepam for this. If there are parts of your procedure that are uncomfortable, we also have an inhalational anesthetic that just kind of gives you a buzz for a couple of minutes called Pronox. 2 weeks prior to your procedure, it's important to stop blood thinner medications and herbal supplements. Common over-the-counter blood thinners include aspirin, ibuprofen, fish oil, and vitamin E. It's very important if you're having a facial procedure to stop these blood thinners because staying on them can increase your bruising. We will also have likely sent you already any teaching material that's relevant. Create a question list for us if we haven't fully answered your questions, and you may have a pre-op just by phone, through a text message reminder, or we may have you for bigger procedures come to the office so we can talk face-to-face. Typically, all of our consent forms are signed using Clara once all of your questions have been answered. On the day of, it's good to come in as clean as possible if we're doing something large on your body or on your face. If it's just a straight local with a little numbing medicine, you can easily drive yourself. If you're planning on using oral sedation with Valium, you will need a ride home. Again, have some food in your tummy, and if it's a longer procedure, say longer than 2 hours, go light on drinking a lot of fluids because we certainly don't want you to have to go to the bathroom in the middle of the procedure. Wear comfortable clothes like a hoodie or something you can get into easily, and if you're having a laser procedure, bring a dark towel so you can kind of wrap it over your head like a scarf and not scare everyone as you're going out to your car. If you're planning on using a little oral sedation, you can take your medications before you arrive. We recommend that 2 Tylenol, 1 to 2 Valium, your antibiotic, and if you are prescribed Celebrex, you can take one of these as well. So these can all be taken before you arrive, but it's very important to bring all of your prescriptions with you to your procedure. After your procedure, if it's something simple, you can go about your day. But if it's something a little bigger, why don't you just go home and rest? You can use cold compresses on the surgical site and elevation if that's appropriate. You also need to know when it's okay to take your next shower. If you have sutures, you will likely be applying antibiotic ointment on these sutures for the first couple of days after surgery, and then you can switch over to Aquaphor. I also recommend using a Band-Aid to keep the area covered if it's on your face or on your ears if you're going to go to sleep at night, because if you're like me, I mush my face into the pillow, and it's good to have those incisions covered. If we use Dermabond, which is a medical superglue, we'll also apply a strip of hypoallergenic tape, and this requires no care. Your follow-up appointment will be scheduled based on how your incisions are closed. If you have sutures that need to be removed, we will likely see you in about 3 to 6 days. If you have Dermabond and there's no care needed, we can likely see you in 1 to 2 weeks. At your follow-up appointment, we'll discuss what's necessary for scar care. All right, that was easy. If you have any specific questions, please let us know, and we'll be seeing you at your procedure.